Dear colleagues, my name is Dominika KOHANOVÁ. I work at the Department of Nursing Faculty of Social Sciences and Healthcare Constant in the Philosopher University in Nitra, and today I would like to briefly introduce a topic titled Enhancing Patient Safety Among Nursing Students, Project for Safe Provision of Nursing Care and Educational Innovations, which was also supported by the governmental project Safe Provision of Nursing Care in Slovakia. The safe provision of nursing care represents a cornerstone of healthcare quality, and nursing students' clinical placements play a critical role in preparing them for such responsibility. Clinical placements also allow students to apply theoretical knowledge in real-world clinical setting and also develop practical skills and gain exposure to the complexities of patient care. However, these experiences can also reveal some kind of challenges, such as nursing students' preparedness or uh, emotional response to clinical practice, or some institutional barriers which can impact both their learning but also the safe provision of nursing care. By identifying key themes, the research highlight areas for improvement in clinical training programs. Addressing these issues could better prepare nursing students for the provision of safe, quality, and effective nursing care. So our aim was to develop e-learning modules focusing on strengthening the patient safety teaching in Slovakia using the sequential explanatory mixed method design, which allowed detailed investigation of the patient safety phenomenon and provided a comprehensive understanding of the research issue. The empirical data collection will be carried out within the two phases to reflect the chosen research design. So the first was the quantitative research conducted between October and November last year using the questionnaire set, which consisted of three specific tools. The first one was focusing on measuring patient safety culture, the second one on nursing teamwork, and the last one for unfinished nursing care. Based on results of quantitative research, we developed a protocol for semi-structured interviews. So the qualitative research represented the second part of this research, the target group of respondents being undergraduate and postgraduate nursing students and also lecturers or nurse educators involved in teaching of clinical subjects. Within the data collection, so in-depth semi-structured interviews were used. The approximate length of interviews was around 40 minutes. Interviews were recorded on using audio recorder and transcript verbatim. Data collection was carried out until the saturation of the data, and data analysis reflected the procedure according to Brown and Clark, the thematic reflexive analysis. So here are the preliminary results regarding the qualitative research. So as you can see, we identified five meaningful themes that reflected the nursing students' experiences with the safe provision of nursing care in Slovakia. So these themes included mentorship and support, practical learning opportunities, challenges in team dynamics, emotional responses to clinical practice, and finally institutional barriers. Based on this quantitative and qualitative research, we developed specific e-learning modules for supporting strengthening patient safety teaching in Slovakia. The e-learning modules consisted of 6 specific modules, while the first one represented or was an introductory module that reflected some kind of theories, frameworks, or tools, and the other one were specific to specific care setting. These modules included basic nursing techniques, but also were specific and covered specific topics for each module. For example, the ICU. As you can see, these modules included several tasks which were really differ. For example, there were case studies, videos, SWOT analysis, and so on. Here are the main references.